There is a pill that millions of people take every single day without a second thought. It sits in medicine cabinets across the country. It is sold over the counter without a prescription. And there is now strong evidence from multiple large studies involving millions of patients that taking it daily for as little as 3 months may raise your risk of dementia by nearly 50%. And we are not talking about one obscure medication. We are talking about an entire class of very common drugs that people use for allergies, for sleep, for anxiety, for bladder control, and for digestive problems. Drugs that most people assume are harmless because they have been around for decades and you can buy them at any pharmacy without asking a doctor. If you or someone you love is taking any of these medications regularly, you need to watch this video all the way through because the brain damage these drugs cause is not always reversible, and the people most at risk are often the ones taking them most casually. Part 1. What are these drugs and how common are they? The class of medications we need to talk about are called anticholinergics. That is a technical name, but the concept behind it is straightforward. Anticholinergic drugs work by blocking a brain chemical called acetylcholine. And acetylcholine is one of the most important neurotransmitters in the human body. Think of it as your brain's spark plug. It is the chemical that allows neurons to talk to each other. You need acetylcholine to form memories, to pay attention, to process information quickly, and even to control your muscles. Without it, your brain's communication system starts to break down. Now here is where it becomes a serious problem. Anticholinergic drugs are not some niche category of medication. They are embedded in some of the most commonly used over-the-counter and prescription drugs in existence. Let us go through some of them so you know exactly what to look for. Benadryl is an anticholinergic. It is one of the most widely used allergy medications in the world, and most people have it in their home right now. Many over-the-counter sleep aids also contain the same active ingredient as Benadryl, including Tylenol PM and Unisom. People take these thinking they are harmless because they are not prescription drugs, but they carry the same anticholinergic risk. Several anxiety medications fall into this class as well, including hydroxyzine, which is also sold under the brand names Vistaril and Atarax. Bladder control medications like oxybutynin, sold as Ditropan, and tolterodine, sold as Detrol, are anticholinergics. Many medications for irritable bowel syndrome, including dicyclomine, sold as Bentol, are in this class. Even motion sickness patches like scopolamine are anticholinergic. Some of these are prescription medications. Many are available over the counter, but they all share the same fundamental mechanism. They block acetylcholine. And when you block acetylcholine in the brain over an extended period of time, you are essentially cutting off one of the brain's main communication channels, and the longer that goes on, the more damage accumulates. Part 2. What the research actually shows. Let us talk about the evidence because this is not a fringe theory. The data here is substantial, and it comes from multiple independent research groups looking at very large populations. The first major piece of evidence is a systematic review and meta-analysis that pooled data from studies involving over 1.5 million people. 1.5 million. The conclusion was clear. Anticholinergic drug use is an independent risk factor for all-cause dementia and Alzheimer's disease. Independent means that even after controlling for age, health status, and other medications, the anticholinergic exposure itself was associated with increased dementia risk. And critically, the study found that heavier anticholinergic exposure, meaning higher doses or longer duration, was associated with a progressively higher risk. The relationship was dose-dependent. The second study that deserves attention is a meta-analysis of 21 individual studies. This one specifically looked at duration of use and found that taking anticholinergic medications for more than 3 months increased the risk of dementia by an estimated 46% compared to non-use. 46%. From 3 months of a drug that people often take for years. And then there is a third study published in the journal JAMA Neurology that went beyond just tracking dementia diagnoses and actually looked at brain imaging and brain metabolism in people taking these medications. What they found was that anticholinergic use was associated with measurable brain atrophy, meaning actual shrinkage of brain tissue, and it was also associated with reduced brain metabolism, meaning the brain was literally consuming less energy and functioning less efficiently. This is not a subtle statistical association. These drugs change the physical structure and the metabolic activity of the brain. Now, you might be wondering why these drugs are still widely available and commonly prescribed if the evidence against them is this strong. The honest answer is that the risk was not fully understood until relatively recently. Many of these drugs have been in use for decades, and the connection to dementia is something that has become increasingly clear only as long-term population data has accumulated over the past 10 to 15 years. The medical community is catching up, but slowly. And in the meantime, millions of people continue to take these medications without knowing what the research now shows. Part 3. Why the brain is so vulnerable. To really understand why these drugs are so harmful, you need to understand what acetylcholine does and why it is irreplaceable. In your brain, acetylcholine binds to specific receptors on neurons called muscarinic receptors. When acetylcholine binds to these receptors, it triggers communication between brain cells. This communication is the foundation of memory formation, attention, learning, and cognitive processing. The hippocampus, which is the brain's primary memory center, and the cerebral cortex, which handles higher-order thinking and reasoning, are both critically dependent on acetylcholine signaling. When you take an anticholinergic drug, you are blocking those muscarinic receptors. You are essentially throwing a wrench into the signaling system. In the short term, this causes brain fog, slowed reaction times, and confusion. Many people notice this after taking Benadryl. You feel groggy and slow. That grogginess is your brain's acetylcholine being suppressed. But here is the key distinction that most people miss. That grogginess goes away when the drug wears off. In the short term, the effect is reversible. But with long-term use, the damage becomes structural. The repeated suppression of acetylcholine signaling over months and years causes neurons to lose their connections. Brain tissue atrophies. And at a certain point, that damage does not reverse when you stop the medication. This is especially dangerous for people over 50 because of what happens to acetylcholine naturally as we age. Our baseline levels of acetylcholine decline as part of normal aging. This is part of why memory and processing speed tend to slow somewhat as we get older. When you add a drug that further suppresses acetylcholine activity on top of that already declining baseline, you are accelerating the decline dramatically. You are not just blocking acetylcholine. You are compounding a vulnerability that already exists. And there is another layer of risk that is dangerously underappreciated. What happens when someone is taking multiple anticholinergic drugs at the same time? This is far more common than most people realize. A person might be taking hydroxyzine for anxiety, and then taking Benadryl or Unisom for sleep, and also taking oxybutynin for bladder control. Each of these drugs individually blocks a modest amount of acetylcholine, but together they can suppress acetylcholine signaling across major regions of the brain and central nervous system simultaneously. The combined anticholinergic burden is far greater than any single drug alone. Researchers have developed something called an anticholinergic burden score to measure this cumulative effect, and high scores are strongly associated with cognitive decline. This is a pattern that comes up regularly in elderly patients, and it often goes completely unnoticed because no single prescribing doctor is looking at the full picture of what someone is taking. Part 4. The signs that these drugs may be affecting your brain. Because the damage from long-term anticholinergic use builds gradually, many people do not connect their cognitive symptoms to the medications they are taking. They assume the brain fog, the memory lapses, the slowed thinking, are just signs of getting older. And in some cases that may be true. But if you are taking any of the medications we have discussed, it is worth asking whether the drug is contributing. The short-term signs of anticholinergic activity in the brain include difficulty concentrating, a foggy or slow feeling, difficulty recalling words or names, in a general sense that your thinking is not as sharp as it used to be. These effects can be subtle enough that people dismiss them or simply attribute them to age or stress. The longer-term signs that something more serious may be happening include noticeable memory problems that are getting progressively worse, difficulty following complex conversations or instructions, confusion about time or sequence of events, and personality changes. At this stage, the damage is becoming structural and the window for meaningful intervention is narrowing. If you are over 60, If you already have any family history of Alzheimer's or dementia, or if you are taking more than one anticholinergic medication at the same time, your risk profile is significantly elevated, and this deserves immediate attention and a conversation with your doctor. Part 5, what to do about it. Now let us talk about the practical steps you can take, because the goal here is not to scare you. It is to give you information you can act on. The first step is to go through your medicine cabinet and identify every medication you are taking, both prescription and over-the-counter. For each one, search the name of the drug followed by the word anticholinergic, or ask your pharmacist. Most pharmacists are very familiar with this class of medications and can tell you immediately whether something carries anticholinergic risk. You can also ask your doctor to review your full medication list specifically with anticholinergic burden in mind. The second and critically important step is this. Do not stop any prescription medication without first talking to your doctor. This is not optional advice. Some of these medications are managing real conditions, and stopping them abruptly can cause serious problems. The goal is not to stop your medications. The goal is to have an informed conversation with your prescribing physician about whether there are safer alternatives, particularly for anything you are taking on a daily long-term basis. And here is the encouraging part. For most of the conditions that anticholinergic drugs are commonly used for, there are effective alternatives that do not carry the same risk to your brain. For sleep, non-anticholinergic options include melatonin, magnesium, ashwagandha, and chamomile. On the prescription side, a medication called trazodone has minimal to no anticholinergic activity and is widely used for sleep. If you are currently using Unisom or Tylenol PM every night, this is a conversation worth having with your doctor as soon as possible. For allergies, second-generation antihistamines are a much safer choice. These include cetirizine, which is sold as Zyrtec, loratadine, sold as Claritin, and fexofenadine, sold as Allegra. These work on the same histamine pathway that causes allergy symptoms, but they have far less penetration into the central nervous system and brain compared to first-generation antihistamines like Benadryl. They are not completely free of anticholinergic effects, but the risk to the brain is significantly lower. For bladder control medications like oxybutynin, there is a non-anticholinergic alternative called mirabegron, sold under the brand name Myrbetrek, that works through a completely different mechanism and does not carry the same risk to acetylcholine signaling in the brain. This is worth asking your doctor about specifically if you are on any bladder medication long-term. For irritable bowel syndrome, peppermint oil has reasonable evidence behind it for managing gut spasms and is worth discussing with your doctor as an initial alternative. There are also other prescription options that your doctor can consider depending on the specific nature of your symptoms. Part 6. How to protect your brain now. If you have been taking these medications for a significant period of time, the most important thing is not to panic, but to act. The brain has some capacity to recover when the source of damage is removed and when the right supportive habits are in place. Here is what the evidence supports for protecting and supporting brain health after reducing anticholinergic exposure. Regular physical exercise is one of the most powerful brain protective interventions we have. Exercise increases blood flow to the brain, stimulates the production of brain-derived neurotrophic factor, which supports the growth and maintenance of neurons, and directly counteracts the cognitive decline associated with anticholinergic use. Aim for at least 150 minutes of moderate aerobic activity per week. Walking, cycling, swimming. Any consistent aerobic activity will contribute. Sleep is equally critical. The brain uses deep sleep to clear metabolic waste products, including amyloid plaques that are associated with Alzheimer's disease. Consistently getting 7 to 9 hours of quality sleep is one of the most protective things you can do for long-term brain health. If your sleep is disrupted and you have been using anticholinergic sleep aids to manage it, this creates a particularly harmful cycle that is worth breaking with the help of your doctor. Addressing underlying metabolic risk factors is also essential. Insulin resistance, high blood pressure, and elevated inflammatory markers are all independently associated with increased risk of cognitive decline and dementia. Many of the same habits that protect your heart and metabolic health, a diet low in processed sugar and refined carbohydrates, regular exercise, adequate sleep, and stress management, are the same habits that protect your brain. And finally, social engagement and cognitive stimulation matter more than most people realize. Maintaining strong social connections, learning new skills, reading, and engaging in mentally challenging activities all help maintain the neural connections that aging and anticholinergic exposure can erode over time. The bottom line, here's the summary of what you need to take away from this. There is a class of very common medications called anticholinergics that block a brain chemical called acetylcholine. Multiple large studies involving millions of patients show that taking these drugs for 3 or more months is associated with a significantly increased risk of dementia, brain shrinkage, and cognitive decline. The risk is higher with longer use, higher doses, and when multiple anticholinergic drugs are taken together. The medications that carry this risk are not exotic. They include common allergy medications, over-the-counter sleep aids, certain anxiety medications, bladder control drugs, and some digestive medications. Many people take these for years without ever knowing the risk they carry. If you are taking any of these medications, especially on a daily basis, the most important thing you can do right now is look up whether your medication is anticholinergic and then talk to your doctor about safer alternatives. Do not stop any prescription medication on your own, but do have that conversation. Your brain is irreplaceable. The decisions you make about what you put in your body today will shape the quality of your thinking, your memory, and your independence for the rest of your life. That is worth a conversation with your doctor. Stay consistent, and we will see you in the next one.